In today's video, I am going to talk about vitamin that is very necessary in our health. This vitamin should be taken to all patients with kidney disease. You must take this vitamin because this is the missing link to optimize our health. This vitamin can avoid cardiovascular disease. This vitamin is unknown to most of the medical professionals. So without wasting your time, let us begin. This vitamin is called menaquinone, otherwise known as the vitamin K2. This is K2, not K1. K1 is known for its coagulation function, while vitamin K2 is a totally different vitamin and it has totally different functions in the body. Although they are called vitamin K2 because they have almost similar structure. Now this vitamin menaquinone is a fat-soluble compound with almost similar structure with vitamin K1 or phylloquinone, but totally different functions and effects in our body. Vitamin K1 involves in coagulation or clotting mechanism, while vitamin K2 acts as a director where to deposit calcium ions in our body. In the presence of K2, osteocalcin from the bones is activated through carboxylation process. Once vitamin K2 is activated, it will bind to calcium ions from our dietary intake and will be deposited to the right organs, which are the bones and the teeth. If you are deficient in vitamin K2, calcium ions will be more likely deposited in the walls of your artery, causing atherosclerosis. Vitamin K2 will activate another protein called dephosphorylated uncarboxylated matrix GLA protein, which binds the calcium ions that are deposited in the walls of our artery. So this is responsible for clearing or reversing the calcium plaques that clog in our artery, resulting in an improvement of the elasticity and the reduction of arterial stiffness. So please stay tuned to the end because I'm going to discuss more about it. Now, in the history, I will not talk in details about the history. All I can say that this is known as activator X before discovered by a dentist. He discovered that patients with that this substance is the missing ingredient for tooth and bone health. Once you take calcium from our dietary intake, vitamin K2 has a receptor site to the osteocalcin. So from the clot, removing it and transferring it to the bones and the artery. So that's why this will sweep out most of your calcium ions in the clot, resulting in a reduction in stiffness of the artery and reducing the clot. So the fate of calcium ions when you are deficient with vitamin K2 or menaquinone, more likely the calcium will be deposited to your artery. But if you have menaquinone, this will be deposited to the bones and teeth. So these are the structures of occluded arteries. The middle are the clot. Black portions are the calcium deposits. Now there are other pathogenesis of this one also, like you have high in small dense lipoprotein. But in this video, we are only talking about calcium. So these are the structures of a normal artery and then artery with calcium deposits. So what are the benefits of vitamin K2? It lowers blood pressure, prevents atherosclerosis, prevents cardiovascular disease by removing this calcium, type 2 diabetes risk reduction, prevents osteoporosis, prevents kidney stone formation, slows down the progression of chronic kidney disease, prevents Alzheimer's disease, prevents cancer. The mechanism of action, which I already mentioned earlier, is the the dephosphorylated and carboxylated matrix of GLA protein will bind to your calcium, or resulting in the reduction of the stiff the uncarboxylated osteocalcine will bind to your vitamin K2 menaquinone, depositing to the bones. So I'm gonna show you of studies about calcium. So this is a study from the NATO Pharmacy, the 3 significant vitamin K2 heart health studies coming from the NATO company. Okay, so here's the study here from the NATO Pharma. Okay, here they found that after 1 year of supplementation, menaquinone or MK7 helped subjects significantly decrease the dephosphorylated uncarboxylated matrix GLA protein. The researchers conducted that 1 year supplementation of MK7 tended to improve vascular health in men and women.
The vitamin K2 is the other part of the transportation, because without vitamin K2, you end up with plaquing, calcium plaquing in the arteries.
Where can you get this vitamin K2? Now, vitamin K2 is very rich in a fermented soybean called natto. I believe only Japanese people are eating this one. The Western diet doesn't have this. That's why we are. So the second source is in fermented. This is found in fermented food, but like fermented food like kimchi, sauerkraut, any fermented food. But the problem is the vitamin K2 is not enough to reach the recommended daily requirement. It is found in cheese. But the problem in cheese, there are several forms of vitamin K2. You have MK1, MK2, MK3, MK4, M5, 7 to, I believe, MK11. The vitamin K2 that is found in cheese is found in the form of MK4, and this is a very short-lasting vitamins. It will only last 2 hours in your bloodstream, and after that it will disappear. That's why it is recommended to take the MK7 form, because MK7 form will last longer. Deficient in vitamin K2. Butter has also vitamin K2. Now this is probably the explanation of the French paradox. You know, if you remember the French paradox, that people from France eating more butter and more animal protein have less cardiovascular disease compared to the rest of the world. And why is that? This is the possible explanation, because the butter that they are eating is coming from a grass-fed cow. It has high in vitamin K2. So eggs also has some K2. Goose liver, chicken, supplements in the form of, well, you can buy supplements in the form of MK7. They are available in 100 milligrams per tablet, so you must take 2 approximately. The daily requirement is 180, so 200 is okay. To summarize, vitamin K2 is the missing link of our health optimization. I believe majority of the global populations are deficient in vitamin K2. It's just a matter of time when vascular calcification, atherosclerosis, then cardiovascular disease, or osteoporosis will occur. So take 180 milligrams vitamin K2 per day to avoid heart attack due to clogged arteries. So if you like the videos, please subscribe, because the next video I am going to tell you about a very important will address the inflammations of your kidney. It will reduce your blood pressure, remove most of your symptoms like pain, fatigue, because it will address or direct to the very root cause of the disease. Thank you. Seven, supplements.